Yes, ma'am, you can start.
Good evening, everyone. I welcome all people who have logged in for today's session. As the saying goes, God couldn't be everywhere, so he created Mother, and taking care of her is our responsibility. In regard with this, we have a continued session of day 2 for safe motherhood. So let's begin our today's journey. I request Dr. Uma Shishigiri to give welcome address. Over to you, ma'am.
Thank you, Dr. Savita. Good evening, everyone. Woman is a pillar of a family. Family is pillar of a society. Society is pillar of a nation. Very apt on part of IMA for selecting a topic focused on healthcare of a woman on the celebration of Doctors' Day 2021. Entire human population has undergone a great deal of suffering at the hands of COVID-19 virus. It's a sigh of relief today that the intensity of COVID is on decline. But we are not certain of future, and we need to tread our path carefully and cautiously. However, we cannot ignore our regular health disorders, including lifestyle diseases, pregnancy and its related complications, and so on and so forth. Yesterday, we had a wonderful deliberation on preconception care in general and obstetric care in context of COVID situation. Today, the scientific session is on talk regarding mother, video clip, antenatal and postnatal care. On behalf of KSB and WDW KSB, I'm delightful to welcome you all for the second day of webinar of Safe Motherhood. I extend hearty welcome to our national dignitaries, Dr. J.A. Jayalal, National President, Indian Medical Association, Dr. Jayesh Lele, Honorary Secretary General, National Indian Medical Association, Dr. L. Yashoda, Chairperson, WDW, National Indian Medical Association, Dr. Kavita Ravi, Secretary, WDW, National Indian Medical Association, and Dr. Rajeshwari Amma, who is present over here, WDW South Zone Indian Medical Association. I'm happy to extend a very warm welcome to our state dignitaries, Dr. Venkatachalapati M, President, Indian Medical Association, KSB, Dr. S.M. Prasad, Honorary Secretary, Dr. Madhusudan Karignur, immediate past President, Dr. Suresh Kudwa, President-elect, and Dr. Lakor. I am pleased to welcome today's moderator, Dr. Savita Ramesh, who is the chairperson for WDW KSB, and Dr. Anuradha Parmesh, who is going to chair the scientific sessions. Dr. Anuradha Parmesh is Vice President, Bangalore branch, and Vice President-elect KSB, and subcommittee member of WDW. I also am pleased to welcome our speakers, today's speakers, Dr. Veena S. Bhatt, Dr. Sunita Kuradgi, Dr. Sanjana Tallur, and Soumya Sharan. Last but not least, I extend my special welcome to all the participants joining the webinar. Welcome to you all again for the session. And I hope you all will enjoy the session and return enriched. Thank you so much.
Thank you, ma'am. Thank you, Uma, ma'am. It was a wonderful welcome session. Now I welcome Dr. Veena S. Bhatt to talk regarding mother and enlighten us. Dr. Veena S. Bhatt is a well-known gynecologist and obstetrician. She was working at VISI Hospital, Bhadravati, for about 7 years, and currently she is working at Nayana Hospital. It's her own hospital. She was born in 1967 to Savitri Bhatt and S.S. Bhatt. in a village, Betagiri village, Karwar district. She has done n number of workshops, seminars, conferences, published many articles, and participated as a resource person related to women and health, anxieties in women health, women in literature, women and the futuristic distraught, sensations in women, and social barbarites at state and district level. She writes columns under the heading Spandana relating to problems and queries of women in the leading newspapers such as Prajavani, Vijayavani, Sudha, and Taranga. She's also published many books. A solution to obesity in 2015-16, that is Bojjigire Parihara, a questionnaire on angst in adolescence published by Kuempu University Prasaranga, Tarunyada Tallannagalu, Vicinities of Menstrual Cycle 2018, and many more books yet to be ready for publishing. Rutu Chakrada Sutta Mutta. She has done n number of social activities, and in that, to name them, established Women Health Forum in 2011 on account of International Women's Day. And she's a very active yoga trainer for more than 12 years. By seeing her, we can always tell how fit she is and how training pregnant ladies under the Pradhan Mantri Suraksha Matritva Abhiyan. And she's received many prizes and awards. Few to name them: District and Municipal Felicitation 2009, Asia Pacific Excellence Award by Citizen Integrated Society, Arogya Matha Award Vishwa Hindu Parishad, Suvarna Karnataka Patanjali Ratna 2012, S.N. Malhotra National Award by our All India Gynecologist Association 2014, and Vaidya Seva Ratna by Sugam Academy 2014, Manav Ratna Award 2017, Supreme Literature at IMA State Level Conference Gadag 2017, Excellent Alumni Award by JSS Health University, and Ishwarama Award by Satya Sai Academy 2020, and n number of awards. So I request you, Veena ma'am, to kindly take over and enlighten us regarding mother. Thank you.
या देवी सर्वभूतेषु मातृरूपेण संस्थिता तमस्तस्यै नमस्तस्यै नमस्तस्यै नमो नमः. Very good evening to all of you. All respected chairperson Dr. Anuradha Parmesh and our esteemed president Dr. Venkatachalapati and past president Dr. Madhusudan Karginuru and the secretary, everybody's name is my heart. And Dr. Rajeshwari Amma from different states, they have joined. I really salute everyone. I am very much honored to be with all of you. And I feel really blessed to express my honest and heartfelt view on the subject, which is very near and dear to my heart. And of course, concern to all, mother, mata, mummy, or whatever it may be. As a gynecologist, it is very near and dear to my heart. And it is Ma, Tujhe, Salam. And to be it a mother nature or mother, both embody the aspect of nurturing, life-giving and sustenance. Both are selfless and ever-giving, and it is truly said, heaven is at the feet of mother. And be it a mother nature, but whatever it is, we always say, Matra Devo Bhava first, then Pitra Devo Bhava, then Acharya Devo Bhava. From a classical poem written by William Ross Wallace, entitled What Rules the World, he said that the hand that rocks the cradle is the hand that rules the world. Tottila Tuguva Kai, Deshavannu Alitevi, popularly called in Kannada. It illustrates the influence of a mother placed to her child and in the long run to the society and to the entire nation. That as a mother strives to nurture and teach a child, she explicitly makes the world a much better place. Women are actually given an opportunity and privilege by God to be his partner, in giving life to another human being. That's why I initially told Matra Devo Bhava, Pitra Devo Bhava, Acharya Devo Bhava. See, motherhood is an instinct. It's a passion. Ma means manyate, pujyate iti. In Sanskrit, it is called as. Also, the Adi Shankaracharya told, Kuputro jayate vachidapi kumata na bhavati. You may get bad children, but a mother never becomes bad at any cost to any of their children or to the society or to the nation. But it's a justice meted out to them. Through the mother nature showers her abundant blessings on us. We still want more and look for more and destroy her, deplete her, and take her granted. This atrocity and mindlessness has led to many natural calamities, but still we haven't learnt a lesson. Likewise, our mother too endures the pain and bears the brunt. For when, that's why, it's a rebirth they call. For when a child is born, the mother is also born again. Rishi Lake opined that motherhood is the greatest thing and also the hardest thing in the world. Mother is our safe vault where we deposit all our worries and insecurities, and she is ever ready to lend her shoulder and motivate us. Her family means the world to her, and she clings to it with love and pride. Many times she has and we overlook her needs and wants, prioritizing her family. In Indian women, 80% of women, they suffer from this syndrome called a saint syndrome. In Kannada, we call Santara Kaile. Because so many times they neglect their own health, thinking that they are very healthy and happy, only thinking about the children and the husband and the other family members. 50% of the women are still suffer from anemia. We have 75 years cross after the independence. It's a shame on us. We are no better than a smaller countries like Bangladesh, Bhutan and Nepal. They are better than us in anemia and maternal mortality rate also. So actually 1,000 days of life is very, very important in a child's journey. So yesterday and day before yesterday, we had very good talk from the All India IMA program. I attended it. So nicely everything was articulated. Today also, the other speakers, they are going to talk about the prenatal and the postnatal everything. I am just telling about the introduction to motherhood and mother. And so many women are now, the 4 out of 10 women are suffering from PCOD problem, lifestyle diseases. So much. The Indian saint syndrome, they are suffering 80% of the women. And the mother is the one who can take place of all others, but whose place no one else can take, says Cardinal Mamillan. In the present COVID scenario, mothers are overworked in trying to keep the family safe and sound. It's literally tough to manage their career and cater to tickle the taste buds of their families 24/7. Today, let us really make the honest pledge to respect and loving nurture mother. An unknown saying beautifully sums up roles of mother. Life doesn't come with a manual, it comes with a mother. Really, there are 4 steps of achievement, whatever it may be, motherhood or anything. You should plan purposefully, we should prepare prayerfully, we should proceed positively, we should pursue persistently, said by William Ewart. So, all the women or the mother, they should plan the pregnancy. It should not be a chance. It should not be an accidental. It should be a planned one, every pregnancy. And we should prepare very prayerfully. We should always think there is something we should do, that Sharanagati. In yoga, we call it as Ishwari Pranidhyana. And that will give us mental peace of mental health. And we should always proceed positively and pursue persistently. So I wish the journey of motherhood begins as soon as the woman is born. She should be nurtured well And at the age of 12, our Foxy says by the age of 12, HB should be 12. And before marriage, they should have the proper knowledge of reproductive health, and they should know about the contraception before marriage. And once the pregnancy is happening, everything about the nutrition, about the exercise, everything they should think. That's how they can really enjoy the journey of the motherhood. I wish all the women safe motherhood, and thank you for the opportunity given. Thank you one and all. And I thank really one and all the office bearers. Because of lack of time, I could not tell everybody's name. So my everybody's name is in my heart only. So I thank everyone.
Thank you so much, Veena ma'am. It was indeed a very enlightening talk regarding mother. Now I request John to play a video wherein a journey of mother is briefly illustrated along with our WDW subcommittee members, member picks. Let's have a look.
ಮುತ್ತು ಭಾವದೊಳಗಿನ ಗಮ್ಮತ್ತು
Volume, John.
ಸಿರಿಯ ಅವಲತ್ತು ಮರಗಳ ಸಾಲಿನ ತಂಪತ್ತು ಇವೆಲ್ಲಕ್ಕೂ ಮೀರಿದ ಸಂಪತ್ತು ಮಾತೃವಾತ್ಸಲ್ಯದ ಮುತ್ತು ಮುತ್ತು ಆಕೆಯ ಕೈತುತ್ತು.
John, volume.
गोदी उठा लेना माँ, आंचल से मेरा मुंह पोंछ देना, मैला सा लागे जहाँ। आंखें दिखाए मुझे जब जिंदगी, याद मुझे आती है तेरे गुस्से की। डांटा भी तो तूने मुझे फूलों की तरह, क्यों नहीं माँ सारी दुनिया तेरी तरह।
Feeling utmost happy to tell it's written, compiled and directed by none other than our dynamic vice chairperson, Dr. Sanjana Tallar. A very nice video, ma'am. Now it's time for our scientific session. Let's begin our scientific session, which is shared by our favorite Dr. Anuradha Parmesh. She is a pillar and backbone of our IMA, KSB, WDW, ever ready to help us in all situations. Dr. Anuradha Parmesh, she completed her MBBS in Bangalore Medical College and residency in OBG from Vani Vilas Hospital, Bengaluru. She has done a PG diploma in maternal and child health from IGNO at KIMS, Bengaluru. She is a fellow of Academy of General Education. She is Vice President, IMA Bengaluru Branch 2021, Bangalore Divisional Coordinator 2021, Member Subcommittee WDW IMA KSB Women MC Member of IMA KSS 2019 to 22. She is Vice President Elect 2021-22 IMA KSB. She is involved actively in all IMA activities, including membership drive, IMA KPPS, IMA KSS membership, also participated in agitation against KPME Act amendment at Belga. She has been EC member, joint secretary and presently is honorary secretary of FPA Bangalore. She is a member of various professional bodies like IMA, BSOG, IMS, FPAB, AARO, CSEPI. She has chaired several scientific sessions and has been an active participant in various CME and conferences. She was organizing secretary for FPCon 2017 and actively involved in organizing AICOG 2019 Bengaluru. She has delivered several talks on women health and conducted school health and adolescent health programs in schools and colleges through FOXY. She has been participating in several camps conducted by BSOG and IMA. Her focus is on high risk pregnancy, infertility, prevention of cervical and breast cancer, and chronic diseases. Her clinic was one of the 5 chosen for visit of brand ambassador, sign actress Samira Reddy, for promoting vaccination for cervical cancer prevention by MSD Pharma. I heartily welcome you, ma'am, to chair today's scientific session. Over to you, ma'am, Anuradha, ma'am.
Thank you, Dr. Savita, for the kind introduction. Yes, we had a very good illustration of a mother by Dr. Veena Bhatt. It was super. It was excellent. Thank you, Dr. Veena, for the same. And also video presentation well compiled by Dr. Sanjana. It was too good. So before I start off, I would like to thank Dr. Savita and IMA KSB WTW team for choosing me to be part of Safe Motherhood Week celebrated by KSB WTW. And sincere welcome to each and every one of you who have logged in. IMA from IMA headquarters as well as from IMA Karnataka State Branch Managing Committee, and also all my friends. So now the first topic that we for today is antenatal care, and the speaker is Dr. Sunita Kuradagi. So I would like to say a few words about her. So edification plays a very important role before anybody starts to speak. So I need to edify and speak about good things about Dr. Sunita. Born in Mysore, done her schooling and PUC in Bangalore. She's done her MBBS from Basveshwara Institute of Medical Sciences, Chitradurga. Post-graduation from Davangere, and she is a rank holder also in college in MBBS. And she, after her post-graduation, she worked in Kerala, PKDIMS, subsequently Vatsalya. She worked at Vatsalya Mandya, and now she's back to Gadak since 2012, and she's been attached to Lakshmishwara Mundagi Government Hospital, and on her own, they have their own hospital, Aishwarya Multi-Speciality Hospital. And to say a few positions that she has been holding, she has been the secretary to the OBG Society Gadak 2013-14, and secretary IMA Ladies Wing 2015-16, president IMA Gadak 17-18, secretary Lioness Club, and most important about her, where we came to know during her activity in the IMA Women's Wing. She won the National Appreciation Award for the Gadak branch as the best, and she was declared as the best chairperson in the national conference. Now she will tell us more about a care to be taken by the treating obstetrician, keeping good outcome in mind, a healthy mother and a healthy baby. Over to Dr. Sunita for her talk on antenatal care. Sunita.
Yes. Good evening, everyone. Can you hear me right?
Yeah, we can.
Okay. First of all, I like to thank our chairperson, Dr. Savita Ramesh, vice chairperson, Dr. Sanjana Kallur, and very importantly, Dr. Anuradha ma'am and all WDW team for giving me an opportunity to be a part of this program. And we are celebrating the Safe Motherhood journey from 1st July till 7th July. And many talks have been already conducted. And the talk which I am giving is on antenatal care. antenatal care is a vast topic, very vast topic. I'll try to cover most of the things. And before coming to the topic proper, I should say that uh, motherhood journey starts from a birth till a death, and then pregnancy period is the most important period during this journey, and it is like rebirth to a woman. So utmost care should be given during this period for her. So we give more importance, we government of India give more importance for this pregnant period, and so many activities have been covered under this care. So I've made my slides very simple because not only
Dr.
gynecology.
Sunita, please share your screen.
Yeah.
We are not able to see.
It's not coming?
No.
Not yet.
Not
Does it say?
Not yet.
Okay, I'll do it. Okay, now?
Not yet.
Now, ma'am?
No.
No, ma'am.
John, I think ಅವರು ಲಾಗೌಟ್ ಆಗಿ ಬರ್ಬೇಕಾ ಮತ್ತೆ?
No, ma'am. You Sunita, come
now
to screen share.
Yeah. Two
now
minutes.
it's
Now your video is on, and now come to screen share.
Yeah.
Now you go to your PPT.
Okay?
Yeah. Yes.
Okay.
You can
Coming
make
right?
you can make a slideshow and start.
Okay?
Yes.
Okay. Sorry for that. Okay?
Yes.
Okay. So keeping that in mind, that not only gynecologists are here, all the MBBS doctors are here, and also I heard Dr. Prasad sir saying that he has shared the link to nursing colleges also. So I have made my slides very simple, so that each and every doctor, each and every healthcare worker should be able to give this antenatal care to the mother. So what is this antenatal care is? It is a periodic and regular supervision, including examination and advice of a woman during pregnancy is called antenatal care. The supervision should be regular and it should be periodic in nature. Like there should not be any strict rules. It should be according to the need of the individual. Okay. And what are the main aims and objectives of antenatal care? It is to promote, protect, and maintain the health of the mother during pregnancy, to screen the iris cases, to prevent or detect and treat the complication at the earliest, to educate mother about the physiological and psychological changes that occur during pregnancy and how the labor happens using charts, diagrams, or videos so that we can prepare her mentally, to discuss with the couple about the place, time, and mode of delivery and newborn care, because this plays an important role because we have to involve the family with here. If she comes under iris cases, then we should tell her that she has to deliver at the tertiary care center. So she should register there at the earliest. To motivate the couple about the need of the family planning, birth spacing should be explained here. To advise the mother about breastfeeding, postnatal care, and immunization. So when these services should be given? According to WHO or FOXY, at least she should have 4 visits. Around 16 weeks, between 24 to 28 weeks, at 32 weeks and 36 weeks. But generally, we ask them to visit every month up to 28 weeks, every 15 days once up to 36 weeks, or weekly interval up to our expected date of delivery. So what all to be done during this antenatal care? These 4 points, what I am telling, it is very, very important. One is careful history taking, where 90% of the diagnosis is made there. Detailed examination, 99% of the diagnosis is made there. Investigation is just 1%. To confirm our diagnosis, we'll be doing the investigation. And finally, after coming to the diagnosis, we have to give them proper advice and categorize them into low risk, high risk, and give them proper advice for the delivery. So first visit, Whenever the patient comes to you, she may come when the UPT comes positive, or she may come anytime during the pregnant period. The things we have to ask her is, first is particular of the patient, register the patient. Then particulars of the patient is very important, that name, age. Age is important for to rule out teenage pregnancy or elderly gravida. Teenage pregnancy, again, there is chances of anemia, preterm birth, malnutrition. And in elderly primary gravida, there is risk of hypertension, diabetes. So age becomes a very important factor. And then our occupation, whether she is doing any strenuous activities. So we can tell her to avoid that. And her place, whether our place is far from the healthcare facility. So the traveling should not be an issue. We can advise her proper place where she can go for a checkup. Next are chief complaints. Usually in the first trimester, generally she will complain of nausea, vomiting, slight abdominal pain, then giddiness. These are all morning sickness. These are all common symptoms. Apart from that, we should ask her leading questions like if she has any vaginal bleeding, white discharge, severe pain abdomen, so that we can rule out signs of abortions or vaginal infections or ectopic pregnancy can be ruled out by asking these questions. And vomiting, again, I say like some amount of nausea, vomiting is common in pregnancy. If it is excess, we have to again be careful with that. Then past history, medical history. If she has been treated for any diabetes, hypertension, hypothyroidism, or if she was being treated for tuberculosis or epilepsy, that should be asked for. And then surgical history, it could be gynec surgeries or abdominal surgeries. We should ask in detail, because if she is going for cesarean section, we can be mentally prepared regarding additions, etc. Then obstetric history, GPLAD is very important. That is gravida, para, leaving, abortions, and deaths. Gravida, whether she is primary gravida or multigravida. Multigravida, history of previous pregnancies is very important here. With previous pregnancy, whether she had any problem during the pregnancy like PIH, gestational hypertension, gestational diabetes mellitus, hypothyroidism, preterm delivery, PPROM, PROM, all those things. And then whether it was normal delivery or cesarean section, why the cesarean section was done, what was the weight of the baby, sex of the baby, whether the baby cried immediately, whether there was any postpartum complications. Everything in detail should be asked, because there is higher chances that she may have the same complication in this pregnancy. So we can put her in high risk pregnancy group, and we can manage accordingly. And previous history of abortions, whether she had recurrent first trimester abortion, then screen for chromosomal abnormalities, especially Downs. And then if she had second trimester pregnancy losses, then look for any cervical incompetence. Put a cervical encirclage earlier, so that she will not abort this time. Okay, these are the things we should ask in obstetric history. Then comes the menstrual history, whether her cycles were regular. Ask for last menstrual period to calculate her expected date of delivery. Expected date of delivery should be given in the first visit itself. It will not change any time during the pregnancy. I have seen patients coming with different scan reports with different EDDs. Okay, this is problem with doctors other than the gynecologist who is treating her, give her different delivery dates. Sorry for that, because she'll be in a confusion when to deliver and finally end up in preterm delivery or post-date. So we have to give her expected date of delivery in her first visit itself. If her periods are regular, then our LMP based EDD is the EDD. Otherwise, we have to do the scan and give her the expected date of delivery. Then family history of multiple pregnancy, hypertension, diabetes, hypothyroidism again plays an important role here. Drug history, if she is on any anticonvulsants, anticoagulants, steroids, or antihypertensive oral hypoglycemics, because we may have to stop few drugs during pregnancy, which is dangerous to the fetus, or we can tell her to continue the same thing if it is not dangerous. Then history of allergy to the drugs, we have to ask so that we can prevent giving them. So after history taking, so many things we have ruled out in history only, like by our complaints and by our history. So next comes the examination part. Examination involves general examination and the abdominal examination. In general examination, again, height is important, because if she is very short, that means she is prone for cephalopelvic disproportion. C-section. She may end up in cesarean section. So she can't deliver in the primary healthcare center. So we have to tell her that she needs a tertiary care center or where the cesarean facility is available. She has to go there during her labor pains. Then weight, obesity or malnutrition, both can BMI. Actually, we have to calculate her BMI. And if she is obese, then there is she is for high risk for diabetes mellitus and hypertension. If she is malnourished, she is prone for anemia, PPH. Then again, pallor we have to look for conjunctiva, nails, palms. Okay, and then anemia can be easily detected. Pictures, liver diseases, like cholestasis in pregnancy is very common. So by just looking at the conjunctiva, the icterus or below the tongue, if it is yellowish color, then go for liver enzymes. Then edema of the face, body or limbs. We have to suspect PIH, renal problems, cardiac problems or anemia. If she is having cyanosis, which is especially seen over the mouth and the ear, then there may be some cardiac problems. Clubbing, there may be some cardiac problems or respiratory problems. See, general examination tells us a lot, right? So never forget our basics. Then vital signs, look for a temperature. If the temperature is raised, there may be some maternal infections. Rule out those things because maternal infection, especially torch infections, can cause congenital abnormalities. So simple temperature, raise in the temperature, just do blood investigation and rule out maternal infections. Pulse and blood pressure. Blood pressure is very important. We have to check her blood pressure whenever she visits you. And if it is equal or more than 140 by 90, then we categorize her as hypertensive. Then depending on her gestational age and whether she was hypertensive prior to pregnancy, we classify her into gestational hypertension, preeclampsia, or superimposed preeclampsia, like that. What is difference between gestational hypertension and preeclampsia is gestational hypertension, our BP will be more than 140 by 90 alone. There won't be any signs of preeclampsia. In preeclampsia, along with raise in BP, there will be other signs like urine albumin will be present and other signs of preeclampsia will be there. So BP measurement is very important. Then breast examination, most of us will forget because retracted nipples or inverted nipples are very common, which will be affecting her lactation later. So we have to examine her breast and then ask her to take care of it. If there is any retracted nipples, ask her to manipulate it or simple massage, just pulling it, we can correct it. Then cardiovascular system and respiratory system should be examined to rule out any cardiac problems. Then comes the abdominal examination. Abdominal examination in first trimester, it will be soft to rule out any masses like ovarian masses or any surgical conditions. And then later on, we have to go systematically like inspection, palpation, and auscultation. Like in inspection, you have to see whether there was any scars, like previous cesarean section scars or surgery scars, any hernias. And then we have to palpate and look for the symphysospondylite, whether the baby is growing properly. By just looking at the symphysospondylite, we can tell our gestational age. Scanning is not necessary there. Just simple. If it is at the umbilicus, you can tell she is around 22 to 24 weeks. Right. So it is like that. And then auscultation using stethoscope and or using this Doppler. This Doppler is very useful, I tell you, because we can detect the fetal heart rate at the earliest. After 20 weeks, we can hear the fetal heart rate using this Doppler. And it is very patient friendly, doctors friendly, and patient also feel very happy when she listens to the fetal heart rate. And then investigations. Okay, history over and examination over. And then comes the investigation. The basic investigation as soon as the pregnancy is confirmed. These are the investigation we have to do. CBC, again to rule out anemia. HB to rule out anemia. If anemia normal, it should be more than 11 in a pregnant woman. And again, depending on hemoglobin levels, we classify her into mild, moderate, and severe anemia. Mild is between 10 to 11, and moderate is between 9 to 10, and 7 to 9, 9.9, and severe is less than 7. Okay, depending on the severity of anemia, we have to treat her. And then CBC again, we'll get to know the total blood count. So we can again see is there any infections in her, and again do special investigations for her. Blood group and RH typing. If she is RH negative mother, then we have to do the husband's blood group, and then the follow differs. Then urine routine to rule out urinary infections, because asymptomatic bacteriuria is very common in pregnancy, and urinary infection is also common in pregnancy. We have to treat it at the earliest because it may lead to abortions or preterm delivery or PPROM. Next, a sugar test, oral glucose challenge test. It is done anytime during pregnancy, and it can be done at no need of fasting stage for this. 75 gram of glucose mixed in 300 ml of water. Ask her to drink within 5 to 10 minutes, and then do the blood glucose levels after 2 hours. If the blood glucose level is more than 140, then she comes under GDM. So treat her accordingly. And depending upon the values, you can treat her with diet or oral hypoglycemics. Metformin is safe in pregnancy, or insulin. Next, in order to rule out maternal infection, VDRL, HIV, HBsAg should be done. If it is positive, again we have to treat them. HIV, we have to start on antiretroviral therapy for her from 16 weeks onwards till the delivery. And the management here differs. Proper family counseling is necessary here, and then we have to prevent the vertical transmission. We have to tell her where she has to deliver the baby, and also postnatally also the baby has to receive nevirapine to prevent the HIV infection. Then HBsAg positive mothers, doctors also has to take care while treating this HIV and HBsAg patients. If she is HBsAg positive, first do HBsAg for family members also, and immunize them, and then after the delivery, take proper precautions during delivery. After the delivery, we have to immunize the baby with immunoglobulin within 12 hours, and with HB vaccine as usual. Then TSH is must for all pregnant women. The level we have to maintain here is in first trimester, it should be cutoff is 2.5. In second and third trimester, it is 3. If she is already a hypothyroid patient, we should increase her eltroxin level dose by 25 to 50 microgram. That is 30%. We have to increase the dose. As soon as the pregnancy is confirmed, we have to increase the dose to prevent cretinism and hypothyroidism in baby. And ultrasonography is must, and it should be done. And I'll go in detail for it later. And what are the special investigation you do? In anemia, we have to rule out what type of anemia she is having. Not treating everybody with iron. Okay, all anemia is not iron deficiency anemia. Okay, so we have to investigate properly, see what type of anemia it is. It could be sickle cell anemia, also do sickling test, or it could be megaloblastic anemia, treat with folic acid or vitamin B12. Then most common is iron deficiency anemia.
Sunita, 5 more minutes.
Yes, ma'am. When you do all this test, you will come to know what type of anemia and treat her with iron. And then preeclampsia is again a risk factor where hypertension, proteinuria, and edema is the criteria for that. Again, we have to do these special tests in these conditions. And then in RH negative mothers, indirect Coombs test should be done at 28 weeks. And if it comes negative, we have to give her anti-D injection 300 microgram intramuscularly and repeat it after delivery if the baby is RH positive. And then USG Doppler is done antenatally. Ultrasonography, at least 4 scans is necessary. One is at around 6 to 10 weeks. This is called viability scan to confirm intrauterine pregnancy, to confirm pregnancy first of all, and to rule out ectopic pregnancy, and to assign to know the gestational age. And 11 to 14 week scan, we call it NT scan.
Sunita, network problem?
Dr. Sunita?
Network problem ಕಾಣಿಸ್ತಾ ಇದೆ.
Yeah, we have lost her completely.
By the time we get Sunita on the line, I would request our National Headquarters Women Doctors Wing Vice President, Dr. Rajeshwari Amma, to say a few words. We missed out on her speech yesterday. Madam, I request you to say a few words to our KSB team.
Dear Dr. Savita, Dr. Anuradha, Dr. Sanjana, and your branch state president, Dr. Venkatachalapati, Dr. Prasad, and all the WDW leaders. Yesterday, I couldn't join in time because there was an emergency in my clinic. So I had to attend that case. Sorry for that. Anyway, I have heard some speeches, Dr. Veena's and Dr. Sunita's speeches, excellent speeches by them. Today also, Kerala is having 3 speeches. So I have to attend Kerala, and our national WDW webinar is there. I have to attend that also. Anyway, you are conducting good webinars. I am very happy to see that all our South Zone teams, especially your Karnataka team and this Telangana, and they are all doing well, and you are doing excellently well under Dr. Savita. And Dr. Anuradha is conducting so many programs. You continue the programs like that. Our South Zone should shine like anything in national WDW. I wish all the best for you all, and see you for the webinar at 8 p.m. Okay, thank you all.
Thank you, ma'am.
Thank you, ma'am, for your kind words. Dr. Sunita, are you back?
Madam called me just now. She's disconnected.
She's trying, isn't it?
Yeah, so we'll ask Dr. Sanjana to go ahead.
Yeah, yes. I will request Sanjana to start her presentation. So now our second topic is on postnatal care, and the speaker is our dynamic co-chairperson, Dr. Sanjana Tallur, Women Doctors Wing co-chairperson. She has done her undergraduation, DGO, MD, all from MRMC Kalburgi, and also working in the same institute as assistant professor. And she's also a consultant at her own place at Kayaka Hospital in Kalburgi only. And she's vice chairperson, Women Doctors Wing, as we all know, and vice president, IMA Kalburgi, managing committee member, KSS IMA, secretary, Gynecologic Society, Kalburgi, and she has held various posts in Gynec Society of both Kalburgi as well as IMA. And she's received the President Appreciation Award by IMA, given by IMA Karnataka State Branch last year. And she is also the recipient of District Appreciation Award by District Health Administration on the eve of World HIV Day. Over to Dr. Sanjana for her talk on postnatal care.
Namaskara ellarigu. Good evening, everyone. Good evening to all respected dignitaries of IMA KSB WDW and IMA KSB main branch, and all the respected dignitaries of National IMA branch and National WDW branch, and all the delegates who have joined in for today's webinar. So I think Dr. Sunita have covered almost all about antenatal care. She was left with ultrasound, and last part she has left it. Later on, we'll continue with her. Now, I'll be taking you or talking about postnatal. The postnatal care, it includes the systemic examination of the mother. It includes the systemic examination of the mother and the baby, and appropriate advice given to the mother during postpartum period. The first postnatal examination is done and advice is given on discharge of the patient from the hospital. The second routine postnatal care is conducted at the end of 6th week. So what is postpartum period? This period begins immediately after the birth of a child and extends for about 6 weeks. As per WHO, postnatal period is described one of the most critical and at most neglected phase of lives of mother and babies. Most death occurs during this period. It is the time after birth, a time in which the mother's body, including hormone levels and uterus size, returns to a non-pregnant state. So, subsequent visit. So WHO has recommended following visits, like at 3rd day, at 7th day, 7th to 14th day, and at 6th day, or whenever there is emergency. By chance, if there is a home delivery, then it is recommended or it is necessary by a health worker to visit the home to see the condition of mother and child. So the principle in management are to restore the health of the mother, to prevent the infection, to take care of the breast, including promotion of breastfeeding, and to motivate the mother for contraception. So immediately following the delivery, the patient should be closely observed for her vitals. Vitals, I mean pulse rate, blood pressure, and temperature. So here, the pulse rate increases following the delivery because of fluid loss or anxiety, fever, but within 2 to 3 hours, it is a transient phase and which comes to normal within 2 to 3 hours. So uterus, look for the uterus, whether it is well contracted or retracted. So the well contracted uterus will be 2 centimeters below the level of umbilicus, or you say 18 to 20 weeks. Okay. Then look for any abnormal vaginal bleeding. So see for a vaginal bleeding. In a normal delivery, usually the blood loss will be around 400 to 500 ml. But look for the bleeding. Like if it is more and the uterus is not well contracted, then we need to monitor her, and it indicates and it warns us for some serious condition, and we need to interfere her. We can manage with the medical management or go ahead with the surgical management if required. During all these phases, it is necessary for us to give a emotional support for the patient. The rest and ambulation, early ambulation is encouraged. So the patient, we do cesarean section, it is always advised like we should encourage her for early ambulation. So the advantage of these early ambulations are it provides a sense of well-being. The bladder complication and constipations are less. It facilitates uterine drainage and hasten involution of the uterus and lesses peripheral venous thrombosis and embolism. The diet, which is the most important part of postnatal period, the diet should be a normal diet, whichever she wants or whichever she wants to eat, let her eat of her choice. But if the patient is lactating, give her high calories of adequate protein, fat, mineral, vitamins. And when it comes to fluids, in some area, they say, if you drink more amount of water, your tummy will be more. So they restrict giving fluids, but always advise and encourage the attenders and also patient to take more amount of water so that the requirement is needed. So, however, in non-lactating mother, non-lactating means when the baby is extreme preterm, when it is an NICU, or if the mother in some condition she would not like to feed the mother, for her a diet is as of non-pregnant lady. So sleep, which is the most important part, she needs both physical and mental rest. So she should be protected against worries and undue fatigue. Sleep is ensured providing adequate physical and emotional support. After pain or painful piles or engrossed rest, they should be dealt with adequate analgesic. The woman is instructed to clean the vulva from anterior to posterior. This is about perineal care. Okay, so from vulva towards the anus, that is never always give her this advice that from the anterior to the posterior she should clean so that we can prevent many infection occurring. So a cool ice pack of the perineum to the perineum may reduce the edema or the discomfort during 24 hours when a perineal laceration or when an episiotomy is given. Local application of the anesthetic spray or ointment or any gel may be applied to relieve her pain. So lochia, which is the most important part of postnatal period, here it is a vaginal discharge on the first fortnight during the perineum. The discharge originates from the uterine body, cervix, and vagina. It has got a peculiar offensive fishy smell and it is alkaline, becoming acidic towards the end. So color, depending upon the variation of color, the discharge is named as lochia rubra, lochia serosa, and lochia alba. Lochia rubra lasts for 1 to 4 days, and serosa lasts for 5 to 9 days, and alba lasts for 10 to 15 days. As the name goes, rubra will be red in color, serosa will be yellowish in color, alba will be white in color. So the composition is rubra contains more amount of erythrocytes and shreds of fetal membranes, lanugo, meconium, etc. But serosa contains more amount of leukocytes and less amount of RBCs. Here, more amount of microorganisms will also be present. But the presence of bacteria is not a pathological condition. Only when it is associated with infection, it becomes a pathological condition. So Lochia alba, it contains more amount of leukocytes, cholesterol crystals, than microorganism and granular epithelial cells. The average amount for 5 to 6 days is estimated to be 250 ml. Coming to the one second. So the character of local discharge gives useful information about the abnormal puriperium. The vulval pads are to be inspected duly to get information of the odor. If it is malodorous, it indicates infection. Retained plugs or cotton pieces inside the vagina should always be kept in mind. So in hurry-burry, we may keep some mop or anything in the vagina. So always look for it whenever the patient complains of some malodor. So amount, if it is a scanty or absent, it signifies infection or lochiometra. If it is excessive, it indicates infection. So the color, persistent of red color, beyond the normal limit signifies subinvolution and retained bits of consumption. So the duration, as I have already said, it lasts for 15 days. If it goes beyond 15 days, then it indicates local genital lesions. So bowel and bladder care, encourage her to pass urine as soon as convenient or as soon as she is comfortable. But if she won't pass within 4 to 5 hours, again you motivate her, encourage her to pass. Again, if she won't pass, then catheterize her and keep for 24 to 48 hours. So the effect may be due to antidiuretic effect of the oxytocin and also perineal discomfort, which is transient and will wean off within 1 or 2 days. So constipation is much relieved by early ambulation and good fiber intake and lot of fluids. Sometimes anal incontinence will also be there. So maternal infant bonding, which is roaming in. So it starts from the first few moments after birth. This is manifested by bonding, kissing, cuddling, and gazing at the infant. The baby should be kept in her bed or in a cot beside her. It establishes the mother-child relationship, but the mother is conversant with the art of baby care so that she can take full care of the baby while at home. Kangaroo mother, what we practices and what our PHC and CHC sisters and midwives practice, that is, put a baby on the mother's abdomen soon after the delivery. It keeps the warmness to the baby, and also a bonding between the mother and child will increase. So coming to the nursing, human milk is an ideal wild food for newborns. In that, it provides age-specific nutrients, immunological factors, and antibacterial substance. Milk also contains factors that act as a biological signals for promoting cellular growth and differentiation. Women who breastfed have lower risk for breast or reproductive cancers. Breastfeeding is associated with decreased postpartum weight. Rate of sudden infant death syndrome are significantly lower among breastfed infants. So the advantages of breastfeeding are nutritional, immunological, developmental, psychological, social, economical, environmental, optimal growth and development, and decreased risk for acute and chronic diseases. The contraindication for breastfeeding, as such, in underdeveloped and developing countries, there is no contraindication for breastfeeding, because when we weigh the risk and benefit of a breastfeeding, always breastfeeding is necessary in underdeveloped and developing countries. But as of Williams, and when we read it, these are the contraindicated which are given, like women who take street drugs or illicit drugs, and who does not have control on their alcohol use, and who have an infant with galactosemia, and patient with human immunodeficiency virus, and who have untreated tuberculosis, and who are undergoing a breast cancer treatment or any type of chemotherapy. Even if she has any viral infections, if the lesion is active, but it is not near the breast, then we can advise her a hygienic breastfeeding, that is, clean the area properly and clean her hand, and she can feed the baby. So immunological consequences. Human milk contains several protective immunological substances, which include the growth factors, serum growth factors. The antibodies in the human milk are specially directed against maternal environmental antigens such as E. coli. According to CDC and prevention, breastfeeding decreases the incidence of ear, respiratory tract, GI infections, NAC, that is necrotizing enterocolitis, and sudden infant death syndrome. So the care of the breast, the nipple requires little attention, then cleanliness and attention to the skin. Fidget nipples render nursing painful, and they may have a deleterious influence on the milk productions. When the nipple are irritated or fissured, some recommended topical lanolin or nipple sheet may be given. We can advise her for the support, that is the breast, or even a blouse will do to give a support to the breast. And also a home remedies like a ghee or a butter can be applied over the breast. If not, then mother's own milk can also be applied over the nipple to keep it wet. So this pain are usually transient and they wean off by 10 days. Asepsis and antiseptic. So asepsis is must to be maintained, especially during the first week of perineum. Liberal use of local antiseptics is done so that to keep the area clean, that is the perineal area. So aseptic measurement during perineal wound dressing, use of clean plaid linen and clothing are positive steps. Limited numbers of visitors should help in reducing the nosocomial infection, and recently we should limit the number because of COVID. Pain, mood, and cognition. During the first few days after the vaginal delivery, the mother may be uncomfortable because of after pain, episiotomy, laceration, breast enlargement, and at times post-dural puncture headache. It may be due to epidural analgesia or any cesarean section. Mild analgesic, preferably in combinations, are given as frequently as every 4th hourly for the first few days. Postpartum blues. So several factors including emotional letdown that follows the excitement and fears experienced during the pregnancy and delivery. These are some of the causes for postpartum blues. Discomforts of early perineum, fatigue from the sleep deprivation, anxiety over the ability to provide appropriate newborn care, and her concern of the body images. All this leads to postpartum blues. The treatment of this includes anticipation, recognition, and reassurance. If these orders are usually self-limited and they wean off within a week or 2 to 3 days, if they does not wean off or if they does not go, then we need to consult a psychologist. Immunization. So RH negative mother, if a baby is RH positive, then we need to give a 300 microgram of anti-D immunoglobulin. Soon after the delivery, we recommend as early as possible, but within 72 hours we can give, or any time within a week. So the immunization about rubella and varicella can be given. TD-VAC can be given if the patient has not taken it before in her antenatal period or during her antenatal period. Influenza vaccine can also be considered. Nowadays, COVID vaccine is also considered. So contraception, which is the most important part, as our Veena madam said, to plan the pregnancy. So for planning a pregnancy, we always need to spacing a pregnancy. So to space a pregnancy, contraception plays very important role. The mother who have completed their family can be offered postpartum sterilization. In non-lactating women needs contraception after 3 weeks of delivery. In lactating women needs contraception after 3 months of delivery. So what are the methods of contraception? The natural method. The natural method cannot be considered until menstrual cycle are regular. So exclusive breastfeeding provides 98% of contraception protection for over a month of 6. The barrier method, which are temporary and they won't give full protection. The steroidal contraception, combined preparations are suitable for non-lactating women, and it should be started 3 weeks after. Progestin only pill is better for lactating women. So IUCDs, that is intrauterine device, are also satisfactory method irrespective of the status. PP-IUCD, nowadays it is quite recommended and practiced everywhere in PHC, CHC, everywhere in the interior. That is postpartum insertion of intrauterine device. It is done immediately following delivery, and though the expulsion rate is more, it is considered as safe. So what advice you want to give her on discharge? Improve her general health by vitamins and iron supplement. So yes, Veena madam, as you said, India is still, we have many patients as an anemic patient. So it is always necessary to rate iron supplement for an postnatal discharge or a postnatal patient. So iron and vitamin supplements are necessary. Postnatal exercises. We should recommend them a postnatal exercise. Little like pelvic tilting exercises, knee ankle exercises, head rising and leg rising exercise, and Kegels exercises. All this helps. These exercises helps to improve the circulation, prevent the backache, and they help in tightening the abdominal muscle, and also they helps in good movement or tone of the perineal muscles. So the gradual return and she can return to her gradual activities day to day. Breastfeeding should be done. Advise her to do exclusive breastfeeding. So immunization and care of the newborn can be taken. Then avoidance of the intercourse for a period of 4 to 6 weeks. Then ask her to come after 6 weeks. So following uncomplicated delivery, she can be discharged after 48 hours. The woman should receive or she should be instructed for the following instructions regarding normal physiological peripheral changes like lochia pattern, weight loss, tyrosis, and milk letdown. Symptoms concerning in that periods are in the postnatal period are fever, excessive vaginal discharge, leg pain, leg swelling, or tenderness. If any of this she finds, then ask her to return as soon as possible. So the persistent headache, shortness of breath, or chest pain are warning, and we need immediate concern. So the follow-up is done usually 6th week to assess the health status of the mother. Medical disorder should be reassessed like diabetes mellitus, hypertension, and thyroid. If required, we can call her before also. So to detect and treat earliest gynecological condition arising out of obstetric phase, and to note the progress of baby, including immunization, and to impart family planning guidance. So I think briefly I have explained about postnatal care. Thank you.
Thank you, Dr. Sanjana. You covered almost everything in the postpartum period. Thanks for that. And Dr. Sunita is coming back to complete her presentation. Sunita, you had left it at anemia during pregnancy.
Yes, ma'am. Can you hear me?
Yeah, we can.
Yeah, please share the screen, ma'am.
Yes. Okay.
Yeah.
No.
No, not yet. Not yet.
We can hear you, but this.
No?
Come back, ma'am. Come back to Zoom and then click on share screen. Yeah, come back to Zoom and now share screen. Yeah.
Can see now?
Yeah. Just go to your
Yeah.
Okay. I'm
Yeah.
very, very sorry for that. I think I was in investigation part, right?
Anemia. Yeah.
Anemia.
You finish this.
Yes.
Next.
So next, yeah. So anemia, if our hemoglobin level is less than 11 grams, then we have to do special investigation for her, because iron deficiency anemia is not only the thing. We have to rule out other
ma'am.
anemia.
Your video is off.
Illa, it's clear.
No, our video, ma'am.
Video is it's seen.
It's seen, sir. It's seen.
Seen, right?
Yeah.
Not.
Yes, yes.
Yeah, you can go ahead.
The
Okay.
slides are seen.
Okay. Most common anemia is iron deficiency anemia. So before treating her with iron supplements or iron injections or blood transfusion, we have to do a certain investigation to rule out other variety of anemias like sickle cell anemia, megaloblastic anemia, or it could be any other hemoglobinopathies. So we have to do the following test to rule out that. And then preeclampsia, again, if her BP is more than 140/90, then we have to do this special test to see for any complication she'll be ending up in, like coagulation profile, hematocrit. The list is there. Okay, I'll not go in detail, but fundoscopic examination is very much important. And every antenatal visit, she should check her urine albumin levels. And in Rh negative mothers, husband blood group is important. If it comes positive, then we should do ICT, that is indirect Coombs test, at around between 26 to 28 weeks. When it comes negative, give her anti-D injection 300 microgram IM, and then repeat it after delivery if she delivers Rh positive baby. And then fetal monitoring should be done using ultrasound Doppler. And ultrasonography, four ultrasound is essential for a pregnant woman. One is in the first trimester, that is between 6 to 10 weeks. This is called viability scan. This is to confirm pregnancy, to rule out ectopic pregnancy, and to assign the gestational age. Second scan is between 11 to 14 weeks. This is NT scan for nupal translucency to rule out Down syndrome. Third scan is around 18 to 20 weeks. This is called targeted anomaly scan, where most of the anomalies will be detected uh, in this gestational age. And this is the most important scan. And the last scan at 36 weeks, this is called growth scan or biophysical profile scan, where to look for the growth of the baby, quantity of the lighter, that is AFI, position of the baby, placental position to rule out placenta previa, so that we can plan the birth. Then second visit or subsequent visits, again, we should ask her any complaints, whether she is appreciating fetal movements, any bleeding PV, white discharge PV, leaking PV, backache, all these questions we have to ask her. And then examine in detail general and abdominal, look for the symphysospondylite, check for her fetal heart rate, and then give her iron and calcium tablets, iron prophylaxis 60 milligram if her hemoglobin level is normal. Then we have to detect PIH at this stage, like do blood BP, check her BP. If it is more than 140/90, then do her urine albumin level. Then do GCT test if she during this period to rule out JDM. Then at 33rd visit, if she comes at 32 weeks, we'll be screening again for preeclampsia by doing urine albumin test and checking her BP, rule out anemia by doing hemoglobin levels and by general examination, and IUGR by simple symphysospondylite or by ultrasonography. Then last visit, when she comes, this is to detect the lie of the baby, presentation and position of the baby, and also check for fetal heart sound, and then plan for the birth. And by this time, we'll be knowing whether she comes under low risk group or the high risk group. So we can advise her properly whether she needs tertiary care or she can deliver at PHC level. After coming to a certain diagnosis, advices is very important. What all advices should be given and when it should be given. Regular antenatal checkups. We should tell her the importance of regular antenatal checkups, why she should come frequently. And if she comes under high risk group, she should come more frequently. So she can end up in certain set complications. So it can be detected earlier if she comes for regular antenatal checkups. Then diet, she needs extra calories during her pregnancy. So give her iron rich foods, whichever is red, yellow, green, orange, give her more. Tell her to take those food more. And calcium rich foods like dairy products, ragi, and protein rich foods like meat, fish, egg, or sprouts. So diet should be advised properly. And drugs, folic acid is advised in first trimester 5 milligram daily, and iron and calcium is added from the second trimester onwards. And if she comes under any risk group, like if she is anemic, then we have to double the dose of iron. Like she has to take 120 milligram of elemental iron, along with deworming has to be done. And we have to categorize her whether she is mild, moderate, severe anemia, and then treat accordingly. And if she is a BP patient, like hypertensive patient, then we have to start her on labetalol or methyl dopa, and then start her on ecospirin. Then the drugs depends on what is her present condition.
Sunita,
Then
can you wind up fast? 2-3
yes,
minutes?
ma'am. Yeah, hygiene, oral hygiene, vaginal hygiene, she need to take bath regularly. Constipation is very common in pregnancy, so she has to take a lot of food, and frequently she has to empty her bladder to prevent urinary tract infection. And clothing should be very comfortable. Do not wear tight clothes, and smoking alcohol is better to avoid during pregnancy. And to prepare her mentally, antenatally only, we have to prepare her mentally to prevent postpartum psychosis. So family support and counseling is very much important. And the rest is ask her to avoid hard strenuous activity, and 10 hours of sleep, 8 hours in the night and 2 hours in the noon is very essential. And complete bed rest is advised in case of placenta previa or previous history of abortions. And breast care is important to rule out retracted nipples, engorged breast, or inverted nipple. This care should be taken during pregnancy only. Otherwise, it will be problematic for lactation. Coitus is better avoided in the first trimester and last 6 weeks. It is completely avoided in high-risk pregnancies, especially in placenta previa, previous abortions. Traveling, avoid in first trimester and last 6 weeks. and jerky traveling is better to be avoided through the pregnancy. Air travel is completely contraindicated in placenta previa, preeclampsia, and anemia. And exercise, some amount of mild exercises or yoga can be advised during pregnancy. It should not be overstrain on the abdomen. Simple meditation is also okay. Immunization, this is very important. I like to stress on this. Immunization, TT or TD injection, 2 doses as soon as the pregnancy is confirmed, first dose, and the second dose within 4 to 6 weeks interval, 2 doses. And then two things I want to tell you at this stage is it should not be given to the gluteal region. It should be given to the upper arm, deltoid region only. And then do not rub the area. Do not rub the area, just press the injected area. Okay, and Tdap single dose vaccine is given after 26 weeks. In, even with TD 2 doses, Tdap can be given single dose after 26 weeks. Then influenza vaccine is also indicated in flu season. We can give this. And the contraindicated vaccines, all live virus vaccines are contraindicated in pregnancy. And COVID, yesterday Geeta ma'am has covered on that. Still, it is in debate in FOXY. Then warning signs, we have to tell her about the warning signs like excessive vomiting, headache, blurring of vision, PV bleeding, PV leaking. And then we have to tell her that when she sees these warning signs, she should come to the hospital immediately. And then lastly, we have to tell her where she has to deliver and what childcare she needs. And then we have to refer her to that particular center. So finally, why we are doing all these things is to screen for the maternal diseases and screen for the fetal anomalies. Okay, these are the common maternal diseases. So these things we have to refer for the tertiary center. And fetal anomalies, if it is treatable, then we have to refer them for the particular center. So after the delivery of the baby can be taken care there. Thank you.
Thank you, Dr. Sunita, for that elaborate presentation. And sorry to everybody because of the network issue, because her power at home went off. So she had to log in again, and sorry about it. And a few words about COVID RT-PCR test to be done during the time of delivery. We usually do COVID RT-PCR test about 5 days prior to the delivery date. Sometimes overlap is there. So for emergency, we need to do the rapid antigen test. That's what I wanted to add. And thank you, Dr. Sunita and Dr. Sanjana, for that elaborate presentation. Almost we have you have covered everything. And questions, I think, double, triple marker tests recommended for which group? Sunita.
If NT comes like if for nuchal translucency, when we do NT scan, if NT is raised, then we go for double marker and triple marker test to rule out Down syndrome.
Double marker we can do as a routine to increase the sensitivity and specificity.
Yes, ma'am. Yes, ma'am.
Yeah. I think other questions we can individually discuss. Now we'll move on to handing over to Dr. Savita to continue the presentation. Thank you once again, Dr. Sunita and Dr. Sanjana, for the excellent presentation. Dr. Savita, you can take over.
Thank you, Dr. Anu, for chairing the scientific session. Since we are the time is out, I now request Dr. Anita D, who's an obstetrician and gynecologist of Pati Hospital, Chikbalapura, to brief about SWAYAM, which is a program launched by WDW IMA National. Over to you, Anita, ma'am.
Thank you, Savita. This SWAYAM is a project of IMA Women Doctors Wing, launched by National IMA Women Doctors Wing team. It is the detection of breast cancer and cervical cancer. It is an initiative for the screening and awareness of breast and cervical cancers, targeting 1 million women population. A few words on this breast cancer. Breast cancer is the most common type of cancer in women. It is reported that with every 4 minutes, an Indian woman is diagnosed with breast cancer. With the latest study, reports Indian highest cancer rate is listed in the state of Kerala. But no need to panic. Prevention is a step away from the cure, and early detection saves the life. So, what are the risks and who are the risks? Women who have family history of breast cancer, and women who consume alcohol and tobacco, obesity, and women who have never had children, and women who never had breastfed, and women working late hours. And how to reduce the risk? And it is the regular exercise, no smoking, no alcohol or less alcohol. Do a regular mammogram. Regularly do breast self-examination. While a mammogram can help you to detect cancer before you can feel a lump, 40% of diagnosed breast cancers are detected by women who feels a lump. So establishing a regular breast examination is very important. Myths about the breast cancer may lead women to delay getting examined or treatment. Don't let misinformation prevent you from getting examined. Information, awareness, and action are the keys for successfully fighting the breast cancer. Coming to the next slide, John. Cervical cancer. Cervical cancer is the fourth most common cancer in women. When diagnosed, cervical cancer is one of the most successfully treatable forms of cancer as long as it is detected early and managed effectively. With a comprehensive approach to prevent, screen, and treat, cervical cancer can be eliminated as a public health problem within a generation. Cervical cancer can be prevented by the regular checkups, pap smear, and HPV vaccine. Get a pap smear test every 3 years once you're 21 or older, or you are 30 to 65, you can get a both pap smear test and HPV test every 5 hours beyond that age. You may be able to stop testing if your doctor says you're at the lower risk. Women of any age don't need screening if they have had their cervix removed or they have no history of cervical cancer or precancerous lesion. The risk factors of cervical cancers are HPV, family history, immunodeficiency, smoking, gene abnormality. Early signs of cervical cancer: discomfort while urinating, abnormal bleeding, pelvic pain, unusual and longer menstrual periods, and loss of bladder control. Outlook of cervical cancer: the survival rate is close to 100% when you find and treat precancerous or early cancerous changes. The prognosis for the invasive cervical cancer depends on the stage. More than 90% of women with the stage 0 survive 5 years after diagnosis. And stage 1 cervical cancer patients have 5-year survival rate of 80% to 93%. Women with the stage 2 cervical cancer have a 5-year survival rate of 58 to 63%. Friends, all these slides will be circulated in all the IMA WD group. Thank you.
Thank you, Dr. Anita, for nice briefing about SWAYAM. Now we'll come to the last part of our session. I call upon Dr. Soumya Sharan, who is an ophthalmologist of Soumya Eye Hospital, Chikbalapura, to give us valedictory. Over to you, Soumya.
Thank you, Dr. Savita. Good evening to one and all. I feel very much honored to be a part of this valedictory and to give the vote of thanks. The end of one chapter is the beginning of another one. Just go on. The best part is yet to come. Yes, like this journey of motherhood, safe motherhood, is just a comma, not the full stop for this beautiful journey. I think many more webinars of the about safe motherhood will be coming up in the next days. I, on behalf of WDW IMA Karnataka State, extend our gratitude to our National President, Dr. Jailal Sir, and our Honorary Secretary General of IMA Headquarters, Dr. Jayesh Lili Sir, for encouraging WDW. Thanks to our National WDW President, Dr. Yashoda Ma'am, and Secretary, Dr. Kavita Ma'am, and also South Zone President, Dr. Rajeshwari Amma Ma'am, who have always been with us and also coming up with new ideas and keeping the WDW on toes to work more and to better. Special thanks to our IMA Karnataka State Branch President, Dr. Venkatachalapati sir. As all of us know, he is a very motivating and inspiring person and always inspires us and believes in teamwork and always encourages us to do our best and give our best in whatever way we do. And today's web series is one of the example of it. Thank you very much, sir. And I also thank our secretary, hardworking IMA Karnataka State Branch Secretary. And I can say is a bag full of patience who can just hear on our problems and give solutions. Thanks to Dr. S.M. Prasad, sir. I thank our WDW Chairperson of IMA Karnataka State Branch, Dr. Savita, who is always cheerful and full of energy and inspiring everyone to do our best and to give our best. And yes, Safe Motherhood Journey web series is the one which she has done in a very less span of time. Thank you very much, Dr. Savita. I thank our WDW Vice Chairperson, Dr. Sanjana Tallur, very dynamic and vibrant person, for her amazing work and dedication shown by her in conducting the whole webinar series, not only of the Safe Motherhood, and we have been seeing all the other webinars conducted by WDW, very well, meticulously worked by Dr. Sanjana. Thank you, Dr. Sanjana. And I thank our past president. I thank our president-elect, Dr. Karnataka State Branch, Dr. Suresh Kudwa sir, and president-elect of 21-22, Dr. Lakol sir, for joining us and always encouraging us. And there will be few exemplary persons in every association who will know everything and anything, and they can give us answers, they can motivate us, and they can give any type of solutions and to whatever the queries we ask. Yes, there are two such persons whom I would definitely want to show the gratitude is our past president, Dr. Madhusudan Karignu sir, and Dr. Yoganand Reddy sir, who have always been very supportive, not only to WDW, in fact, to all the co-committees and all the other committees. Thank you very much, sirs. And yes, Safe Motherhood Journey. As we all know, a woman is just a full circle wherein the power to create, nurture, transform is embedded. She can do anything and everything. And this Safe Motherhood Journey is also a full circle. It started yesterday with an adolescent, the start of menarche of a woman, to today's topic of postnatal care, where almost a circle of giving birth, becoming a mother, of this whole Safe Motherhood Journey. On the first day, we had beautiful presentations. I would like to thank first day's moderator, Dr. Anita D. Ma'am, National Convener of IMA Culturals, and also Vice President of IMA Chikbalapur branch, who is a big guiding force to all of us. In fact, for a women doctors wing to come up in Chikbalapur and also to make the women doctors of Chikbalapur to shine in state levels. Thank you very much, ma'am. She has been a very much guiding force. Yes, as yesterday Dr. Harini mentioned, she's a silent force who just stands behind the screen, helps all of us. And I thank Dr. Anita ma'am for meticulously moderating the whole session of yesterday. I express our gratitude to both the Lifetime Achievement Awardees, Dr. Prema Kundargi ma'am, Dr. Asha Lata Mallapur ma'am, who have been Akshay Patra of advice and experience, who advised us about what to do, what not to do, and gave us the experience of theirs and also about the goals of life. Thank you, both of you, ma'am. And the beautifully conducted scientific sessions chaired by Dr. Aruna Kaminini ma'am, about a healthy pre-pregnancy by Dr. Uma Sheshagiri ma'am, and also women and COVID vaccines by Geeta Dopa ma'am, who have very well and impressively completed their talks yesterday. Thank you very much, ma'am. About today's sessions, scientific sessions, a beautiful presentation of a video presentation of the whole of motherhood of WDW members. Thank you, Dr. Sanjana, for that beautiful video. And Veena ma'am, who gave a talk about mother. Yes, she said, mother is everything. She's just like a sun, emits the energy, light, and gives everything. She is the pillar of a family and a society. She has to be taken care. And that's why we have been conducting these webinars of safe motherhood journey. Very well presented, ma'am. Thank you, Dr. Veena ma'am. And Dr. Sunita ma'am, who gave a talk about antenatal care, an elaborative one, very well explained about the cares to be taken during the antenatal periods and about the scans, about detecting the anomalies and investigations, what all to be followed, not to be followed, and about myths about many aspects. Very well covered, ma'am. Thank you, Dr. Sunita ma'am. And Dr. Sanjana, a marvelous talk, beautifully presented, and who gave the perfect completion for this motherhood talk by giving a beautiful presentation of postnatal care, not only about childbirth, post-childbirth, and taking care of our own body as well as the baby. Thank you, Dr. Sanjana. And special thanks to two beautiful ladies, Dr. Geeta Dopa ma'am and Dr. Anuradha Parmeshwar ma'am, seniors, and Geeta Dopa ma'am, past Vice President of IMA KSB, Anuradha ma'am, Vice President of IMA Bangalore branch, who have been a big support to WDW and always on their toes to give advice and to correct us and to inform us and always guiding us, just like the pillars. Thank you, both of you, ma'am. And I thank the other state dignitaries who have joined the webinar today. Thank you, all the dignitaries. And I thank all the members of beautiful members of WDW, sparing their time and joining for these 2 days of web series. In spite of all of us being bombarded with webinars, have taken out time to join us and make this web series a successful one. And all the office bearers of IMA KSB and office bearers of IMA State WDW, I thank each one of you. Thank you very much. Thank you all the members. And I thank all the participants who have joined through YouTube and who have helped us by asking questions and helped us in making this session a better way. And I, not to forget the person behind this, the man behind this, Mr. John, our web manager, who has been patiently with us, starting from the making of the flyer till now, helping us each and every moment for making this presentation come out in a beautiful manner. Thank you, Mr. John. And yes, I would like to end my vote of thanks with one saying that vision without action is merely a dream. Action without vision is just like that, just passing time. But when action and vision together mixes and comes together, it can change the whole world. Let us join together. Let us forget all the myths and retain only the scientific things which we have got from these webinars, and let us put this in our day-to-day activities. And I'm extremely sorry if I missed out anyone. Thank you. Thank you once again. Good night.
Thank you, Dr. Soumya. That was a wonderful way of valedictory. And I once again give thanks to everyone, each and every person who have logged in, and thanks one and all. Let us join the session of National IMA who are waiting over there for our presence. Thank you.
We'll do the national anthem.
We'll do the national anthem.
We'll do the national anthem.
The national anthem.
And to Dr. Anita ma'am, who explained us about this Swayam and about the breast cancer and cervical cancer, I think which we would have missed out otherwise. A beautiful presentation, ma'am. Thank you.
Thank you. We'll do the national anthem.
में जागे
बोलो भारत माता की जय.
Jai. Long live IMA.
Long live IMA.
Long live IMA. Thank you.
John,
Arun.
thank you for the session.
Thank you. My pleasure, madam.
John, please click a pic of all of us.
Yes. Just a moment.
One smile, we'll give one smile. Anuradha madam smile ಮಾಡ್ಕೋತಾನೆ ಇರ್ತಾರೆ madam. Ever smiling madam ನಮ್ದು. Madam. Full length madam. We support in all the fields.
Yeah, thanks everybody. It's a group work, teamwork. So together we win. We will continue our togetherness, our bondage. Let's continue. We have been gelling with each other very well, and that is the key to our success today. And we shall continue to do.
Meet ಆಗೋಣ madam ಒಂದ್ಸಲ.
Yes.
ಕೋವಿಡ್ ಕಡಿಮೆ ಆಯ್ತು ಮತ್ತೆ ಎಲ್ಲಾನು ಲಾಕ್ ಡೌನ್ ಓಪನ್ ಆಯ್ತು. ಐ ಥಿಂಕ್ ವಿ ಕ್ಯಾನ್ ಮೀಟ್.
ಅಲ್ಲ ಬರ್ತೀವಿ ನಾವು ಚಿಕ್ಕಬಳ್ಳಾಪುರಕ್ಕೆ 4 ಜನ ಇದ್ದೀವಿ.
ಪ್ಲೀಸ್ ಬನ್ನಿ ಮ್ಯಾಮ್. ಮೇಡಂ ಎಲ್ಲರೂ ಬನ್ನಿ ದಯವಿಟ್ಟು.
Chikkolapur team is ever ready.
We'll go there ma'am.
ಮ್ಯಾಮ್ ನಂದಿ ಹಿಲ್ಸ್ ಇದೆ ಪಕ್ಕದಲ್ಲಿ, ಟ್ರೆಕ್ಕಿಂಗ್ ಮಾಡಿಸ್ತೀವಿ.
ಟ್ರೆಕ್ಕಿಂಗ್ ಬೇಡ ಊಟ ಮಾಡಿದ್ರೆ ಸಾಕಷ್ಟು.
ಬಟ್ಟೆ ಊಟ ಹಾಕ್ತೀವಿ ಬನ್ನಿ ಮೇಡಮ್. ನಿಮ್ಗೆ ಏನು ಕಮ್ಮಿ
ಜಾನ್ ರೆಡಿನಾ?
Done, madam.
Done.
Always smiling and
Once more, smile.
Thank you so much.
Thank you.
Thank you.
Thank you all.
Thank you.
Harini, it was good yesterday.
Thank you,
Your
ma'am.
presentation was good. Yeah.
Thank you, ma'am. Yeah.
I haven't met her at all, so I'm exclusively commenting and complimenting you.
Thank you, ma'am.
Was very good.
ಎಲ್ರದು ಚೆನ್ನಾಗಿತ್ತು ಪ್ರೆಸೆಂಟೇಷನ್. ಯಾರಿಗೂ ಏನು ಬೆರಳು ತೋರ್ಸೋ ತರಾನೇ ಇರ್ಲಿಲ್ಲ. Everyone did well. Everyone excelled. Isn't it, Dr. Geeta?
Yes, madam. Everyone has put their heart and soul in the program.
Everyone did their part.
Geeta ma'am, within a span of 2 hours, she gave a wonderful presentation. That was an astonishing part. I mean, really.
Dr. Sanjana is there?
Yes.
Yes.
Madam, I am Dr. Surendra. I studied in Gulbarga, madam.
ಕಲಬುರಗಿಯಲ್ಲಿ ಸರ್. ಹೇಳಿ ಸರ್ ಯಾವ ಬ್ಯಾಚ್?
69 to 74.
Wow.
ನಾನು ಹಿಂದಕ್ಕೆ ಹೋಗ್ಬೇಕಾಯ್ತು ಸರ್. ಉಮಾ ಶೇಷಗಿರಿ ಮೇಡಮ್ ಬ್ಯಾಚ್ ಅಂದ್ರೆ
ಯಾರು?
ಉಮಾ ಶೇಷಗಿರಿ ಮೇಡಮ್ ಬ್ಯಾಚ್.
ನಮ್ ಜೂನಿಯರ್ ಉಮಾ ಶೇಷಗಿರಿ ಅಂದ್ರೆ ನನ್ಗನ್ನ ಜೂನಿಯರ್. ಅದೇ ಅವರು ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿದ್ರಲ್ಲ ಬ್ಯಾಂಗ್ಳೂರ್ ಬ್ರಾಂಚ್ ಗೆ. I was that executive committee member when Uma Sheshagiri was there.
Okay.
Nice.
Yeah. And in which year you have finished from Gulbarga?
ಈಗ ರೀಸೆಂಟ್ ಸರ್. ನಾವು 2000 ಅಲ್ಲಿ ಮುಗ್ದಿದೆ ನೋಡಿ ಸರ್ ನಮ್ದು.
ಹೌದಾ? 2000 ಅಲ್ಲಿ ಮುಗ್ದಿದೆ.
Father idru sir, Uma Sheshagiri madam friend and father.
ಹೌದಾ? Okay. Okay. Thank you.
John will
end the session.
We'll have to log into the national headquarters. The lady of today, she's speaking now.
Yeah.
What's her name?
Dr. Yashoda ma'am will be.
Alla. Preet Sudhana Rao.
Okay. Good night all. Yeah. Good night all.
Good night, ma'am.
Yeah, good night.
Thank you, John. Thank you.
No, my pleasure, ma'am. Good night.
Yes. Thank you.
Thank you, John. Thank you very much. Yeah, bye.
Surendra Avare, thanks. Thanks,
Yeah.
everyone. Yeah,
Okay.
we'll meet up again.
Night all.
So when are we meeting, Savita?
We'll meet shortly.
No, for the next webinar, which Friday?
Yeah. I'll let you know.
No problem.
Just give some time. Okay.
Yeah. Okay.
Yeah.